The primary public health goal of screening is to identify individuals at higher risk of a health problem or condition. This early identification enables timely treatment or intervention to be offered. As shown in this diagram, screening processes direct individuals through testing, identifying those who need further evaluation and potential treatment. The ultimate aim of screening programs is to reduce both the incidence and mortality of health conditions within the population. As this infographic shows, detecting cancers earlier significantly improves patient outcomes. The benefits of effective screening include earlier detection of disease, access to more effective treatment options, and significantly improved survival rates. There is a growing trend in the WHO European region towards more screening for non-communicable diseases and health checks. These non-communicable diseases include cardiovascular diseases, various types of cancer, diabetes, and chronic respiratory diseases. Laboratory testing plays a crucial role in screening programs, with pre-analytic, analytic, and post-analytic phases, ensuring accurate results for appropriate intervention. In summary, the public health goals of screening are to identify at-risk individuals, enable early intervention to reduce disease burden, improve overall population health outcomes, and expand screening for non-communicable diseases across Europe. One of the primary purposes of screening in public health is early detection. Early detection aims to identify diseases before symptoms appear, when treatment is often more effective and less invasive. This data from England shows cancer detection rates by stage. For many cancers, finding them early drastically improves treatment outcomes. Early detection offers several benefits. It provides more treatment options, often requires less aggressive treatments, leads to better recovery and survival rates, and can lower overall healthcare costs. Here's an example of early detection in practice. The ABCDE method helps people identify potential melanoma skin cancer early when treatment is highly effective. Low-dose CT screening can detect early-stage lung cancer, as shown in these scans. The 2004 scan reveals a small nodule that wasn't visible in 2003, allowing for early intervention. The pathway to early detection starts with screening tests that can identify disease before symptoms appear, leading to prompt treatment and better health outcomes. Modern screening technologies allow for advanced visualization methods. Virtual colonoscopy, shown here, enables detailed examination of the colon without invasive procedures, helping detect abnormalities at early stages. Early detection through screening programs like mammography has significantly reduced breast cancer mortality. Studies show a reduction of 20 to 40% in screened populations compared to those without screening. To summarize, early detection through screening detects disease before symptoms develop, allows for less invasive treatment options, significantly improves survival rates, reduces healthcare costs, and is a critical component of effective public health programs. Screening programs serve a critical surveillance function in public health. Surveillance screening involves the systematic collection and analysis of health data to monitor disease patterns in a defined population over time. Surveillance screening serves several critical purposes in public health management. These include monitoring disease trends over time, comparing rates between populations, identifying high-risk groups, evaluating intervention effectiveness, and guiding resource allocation. One key aspect of surveillance is comparing disease burden across different populations. This allows public health officials to identify disparities and target interventions. This chart shows disability-adjusted life years per 100,000 population across different countries. Such comparative data is essential for global health planning and resource allocation. Surveillance data directly informs public health policies and decision-making. It helps identify emerging health threats, allocate resources efficiently, develop targeted interventions, and evaluate program effectiveness. Healthcare organizations use dashboards to monitor key indicators for surveillance purposes. These dashboards track metrics like patient volume, length of stay, costs, and satisfaction scores, providing real-time data for health system surveillance and quality improvement. When establishing a screening program, it's essential to have clear criteria to evaluate its potential benefits and risks. The Wilson and Jungner criteria were developed in 1968 by J.M.G. Wilson and G. Jungner, commissioned by the World Health Organization to guide the selection of conditions suitable for screening. Despite being over 50 years old, these criteria remain the gold standard for evaluating screening programs and are still referenced in contemporary screening guidelines worldwide. The Wilson and Jungner framework consists of 10 essential criteria that help determine whether a screening program is beneficial and cost-effective. By applying these criteria, public health officials can ensure that screening programs provide more benefit than harm, guide resource allocation decisions, and promote evidence-based public health practice. When establishing screening programs using the Wilson and Jungner criteria, it's essential to consider broader influences on population health, including political contexts, community characteristics, and demographic factors. In the following sections, we'll explore each of the 10 Wilson and Jungner criteria in detail, starting with the importance of the condition being screened. Wilson and Jungner's first criterion states that the condition being screened for should be an important health problem. This is a foundational requirement for any screening program, as resources should be directed toward conditions that have significant impact on public health. Heart disease is a prime example of a condition that meets this criterion. It's the leading cause of death globally, with significant mortality rates both in the US and worldwide. Chronic diseases like diabetes and hypertension represent important health problems because of their widespread prevalence and significant impact on healthcare systems. Health priorities must also be considered in a global context. Population growth and demographic changes affect which conditions are most important in different regions. A comparison of current health priorities shows how conditions like COVID-19, cancer, and mental health are considered important health problems deserving of screening efforts. Screening for important health conditions ensures efficient use of resources, maximizes public health impact, and addresses the greatest burdens on society. The second Wilson and Jungner criterion states that there should be an accepted treatment for patients with recognized disease. This criterion is fundamental because screening is only beneficial if an effective treatment exists for the condition being screened for. Without an available treatment, early detection through screening would not improve patient outcomes and could potentially cause unnecessary anxiety. For screening programs to be justified, treatments must be evidence-based, accessible, and lead to better outcomes than when the disease is detected at a later stage. Conversely, screening for conditions with no effective treatments or where treatment risks outweigh benefits would not meet this criterion. The screening pathway must lead to effective treatment to be worthwhile. Without treatment, the entire screening process loses its purpose. In summary, when evaluating potential screening programs, public health officials must ensure that effective, accepted treatments exist for the target condition. The third criterion, established by Wilson and Jungner, states that facilities for diagnosis and treatment should be available. For a screening program to be effective, several essential healthcare facilities must be in place. These include diagnostic centers with specialized equipment, treatment facilities with trained professionals, and effective referral systems. Modern healthcare facilities, like this operating room, are essential for delivering effective treatments following screening. Such facilities must be equipped with the technology and staffing needed to handle cases identified through screening programs. However, there are significant disparities in healthcare facility access. Rural populations often face higher costs and greater distances to reach diagnostic and treatment centers. These disparities must be addressed when planning screening programs. To address these accessibility challenges, innovative solutions like mobile screening units have been developed. These units bring vital screening services directly to underserved communities, helping to ensure that all populations have access to early detection programs. Looking to the future, diagnostic facilities continue to evolve. Integrated diagnostic approaches combine traditional imaging with advanced technologies like deep learning, allowing for more efficient and accurate screening processes. When implementing screening programs, several facility-related considerations are crucial. These include ensuring accessibility for all population groups, appropriate geographical distribution, capacity to handle screening volumes, availability of trained personnel, and quality assurance across all facilities. A screening program is only as effective as the facilities supporting it. The complete pathway from screening to diagnosis to treatment requires appropriate facilities at each stage. Without adequate facilities, screening programs cannot achieve their public health goals of reducing morbidity and mortality. The fourth Wilson and Jungner criterion states that there should be a recognizable latent or early symptomatic phase. But what exactly is a latent phase? It's a period during which a disease is developing within the body but has not yet produced noticeable symptoms. This diagram shows the progression of disease. Screening is most effective during the latent phase, before symptoms appear, but when the disease is already present and detectable. Identifying disease during the latent phase is crucial because it allows for earlier intervention, which typically leads to better health outcomes. During this phase, treatment options are often less invasive, healthcare costs are reduced, and patients can maintain a better quality of life. Let's look at some real-world examples. This infographic shows how early detection of cancers like lung, pancreatic, and stomach cancer can significantly improve survival rates. Many diseases have recognizable latent phases that make them suitable for screening programs. Let's review some examples. To summarize the fourth Wilson and Jungner criterion, for a screening program to be effective, the target disease must have a recognizable latent phase when detection is possible, but before symptoms develop. This is the optimal time for intervention. Understanding this criterion helps public health officials design effective screening programs that can detect disease at the ideal time for intervention. Wilson and Jungner's seventh criterion states that the natural history of the condition, including development from latent to declared disease, should be adequately understood. The natural history of a disease refers to how a condition progresses over time without intervention, from its earliest stages through to its final outcome. Understanding the natural history of a disease means knowing its complete timeline. This includes the susceptibility phase, the preclinical phase where disease is present but not detectable, and the clinical phase when symptoms appear. Effective screening targets the preclinical phase when intervention can alter the disease course before symptoms appear. The window between when a disease becomes detectable and when symptoms typically appear is critical for screening. This graph illustrates how a disease progresses through a population over time. Understanding these patterns helps determine the optimal timing for screening programs. This diagram shows the natural progression of disease from susceptibility through to potential outcomes. Understanding this progression is essential for designing effective screening programs. Understanding the natural history of a disease has several important implications for screening programs. It helps determine optimal screening intervals and identify appropriate target populations. It ensures screening occurs during the detectable pre-symptomatic phase. And critically, it allows assessment of whether early intervention actually improves outcomes. Understanding disease progression directly informs screening recommendations. For colorectal cancer, we know there's approximately a 10-year progression from polyp to cancer, which is why colonoscopy is recommended every 10 years for average-risk individuals. For cervical cancer, understanding the slow progression from HPV infection to cancer guides the 3 to 5 year screening intervals. Similarly, diabetes screening frequency is based on our understanding of how diabetic retinopathy develops. To summarize, without a thorough understanding of a disease's natural history, screening programs risk being implemented too early or too late to be effective. This crucial knowledge ensures that screening efforts are optimally timed to detect disease when intervention can make the greatest difference. Wilson and Jungner's 10th criterion states that case finding should be a continuous process, not a one-time event. Continuous screening is essential for several reasons. Diseases can develop at different time points, population risk factors change over time, and new cases can emerge in previously negative individuals. Additionally, screening technologies and methods continuously improve. Continuous screening follows a quality improvement cycle similar to the Plan, Do, Study, Act cycle used in healthcare improvement initiatives. This ensures ongoing refinement of the screening program. Let's compare one-time screening with continuous screening approaches. One-time screening often misses developing cases, has a limited detection window, doesn't adapt to new evidence, and may be less cost-effective in the long run. In contrast, continuous screening captures cases as they develop, provides multiple detection opportunities, adapts to evolving knowledge, and leads to better long-term health outcomes. Implementing continuous screening requires a well-designed timeline with regular screening intervals appropriate for the condition being monitored. Medical timelines like this help visualize the ongoing nature of screening programs throughout a patient's life. Successful continuous screening programs depend on reliable recall systems, adequate follow-up protocols, ongoing data monitoring, and regular program assessment to ensure they remain effective. Remember, continuous screening leads to better health outcomes and more effective public health interventions compared to one-time screening approaches. To determine when screening is appropriate, we must first assess if a condition is significant enough to warrant population-level screening. Several criteria help establish a condition's importance, including high prevalence or incidence, significant impact on health outcomes, substantial economic burden, availability of effective interventions, and alignment with public health priorities. Let's examine two examples of important health conditions. On the left, we see how climate change affects public health, creating emerging threats that may require new screening approaches. On the right, data shows childhood mortality from preventable diseases, many of which are targeted by established screening programs. Several conditions meet the criteria for population-wide screening programs. These include chronic diseases like hypertension and diabetes, various cancers including breast, colorectal, and cervical cancer, infectious diseases such as tuberculosis and HIV, and congenital conditions detected through newborn screening. The statistics highlight the global burden of these conditions, underscoring why they're prioritized for screening programs. This diagram illustrates how screening works for important health conditions. The process begins with identifying at-risk populations, administering appropriate screening tests, and then routing individuals to further testing, treatment, or advice based on their results. This structured approach helps maximize the impact of screening resources. When determining which conditions to prioritize for screening, cost-benefit analysis plays a crucial role. As shown in this example, the benefits of screening for important conditions can far outweigh the costs. This economic evaluation helps public health officials make evidence-based decisions about allocating limited screening resources to conditions with the greatest public health impact. For screening to be effective, the disease must have a recognizable latent phase or early symptomatic stage. Let's explore what this means and why it's crucial. Disease progression typically follows several stages. The latent phase occurs early when the disease is present but produces no symptoms. This is the ideal time for screening intervention. Screening during the latent stage offers several crucial advantages. Earlier intervention typically leads to better outcomes. Treatments can be less invasive when disease is caught early. There's a higher chance of cure or effective disease management. And overall, early detection is more cost-effective for healthcare systems. Let's look at some diseases with recognizable latent stages that make them ideal for screening. Colorectal cancer often begins as polyps that can be detected years before cancer develops. Cervical cancer has precancerous stages that can be detected with regular pap smears. And hypertension often has no symptoms until it causes serious complications, making regular blood pressure screening vital. When determining if a disease is suitable for screening, a key question is whether it has a recognizable latent stage. If yes, the disease may be suitable for screening programs. If no, screening may not be beneficial and resources might be better allocated elsewhere. This decision pathway is crucial for developing effective public health screening strategies. In screening programs, understanding the positive predictive value is crucial for interpreting test results accurately. Positive predictive value, or PPV, is the proportion of positive test results that are actually true cases of the disease. Mathematically, PPV is calculated as the number of true positives divided by the total number of positive test results, which includes both true and false positives. This diagram illustrates how positive test results include both true positives and false positives. The higher the proportion of true positives, the better the predictive value of the test. Now let's explore how disease prevalence affects the positive predictive value. The positive predictive value is highly influenced by the prevalence of the disease in the population being screened. Let's compare how PPV changes between a low prevalence and high prevalence population, even when using the same screening test. In a population with only 1% disease prevalence, even a test with excellent sensitivity and specificity of 95% will have a PPV of just 16%. This means that 84% of positive results are actually false positives. However, in a high-risk population with 20% disease prevalence, the same test would have a PPV of 83%, making positive results much more reliable. Understanding the relationship between PPV and other screening metrics helps in interpreting test results correctly. Let's examine how PPV relates to other key test performance metrics like sensitivity and specificity. As we wrap up our discussion on positive predictive value, here are the key points to remember. PPV increases with higher disease prevalence and with higher test specificity. In rare conditions, even tests with good sensitivity and specificity can have poor PPV. Always consider the PPV when interpreting positive test results in a screening program. Let's examine mammography as a real-world example of an effective screening program. The breast cancer screening process follows a structured pathway that begins with an invitation and continues through testing, results, and follow-up care. Women between ages 50 and 69 are typically invited every 2 to 3 years for free breast cancer screening. The invitation includes information about the screening process and how to schedule an appointment. The screening test involves a mammogram, which uses low-dose X-rays to create images of the breast tissue. Each breast is compressed between 2 plates to spread the tissue for better imaging. The procedure typically takes about 20 minutes. After the screening, radiologists examine the images for signs of cancer. Results are communicated by mail, typically within 2 to 3 weeks. If abnormalities are detected, women are recalled for further testing. Breast cancer screening has proven to be highly effective. In the United Kingdom alone, it saves approximately 1,300 lives annually and detects around 19,000 cancers each year. Studies indicate that 23% of breast cancers can be prevented through screening programs. In public health screening programs, ethical considerations are paramount, with informed consent being a cornerstone principle. Informed consent is a process with multiple elements, not just a form to sign. It requires clear explanation, disclosure of benefits and risks, discussion of alternatives, and confirmation of understanding. A critical aspect of informed consent is properly disclosing all potential benefits and risks of screening. Benefits include early detection, better treatment outcomes, and reassurance. Risks include false positives, anxiety, overdiagnosis, and physical risks from follow-up tests. Equally important is respecting individuals' choices about screening. People have the right to accept or decline participation without pressure. Healthcare providers must support informed decision-making and accommodate diverse needs and preferences. Implementing best practices for informed consent is essential in screening programs. These include providing clear information materials, allowing adequate time for decision making, ensuring culturally sensitive communication, evaluating the consent process, and training staff on ethical communication. In conclusion, informed consent is fundamental to ethical screening programs. It requires full disclosure of benefits and risks, respects individual autonomy, and should be viewed as an ongoing process rather than a one-time event. In public health screening programs, ethical considerations around false positives require special attention. False positives occur when a screening test incorrectly indicates that a condition is present, when in reality, it is not. For example, in breast cancer screening, several women may receive positive results, but after diagnostic testing, only some are confirmed to have cancer. The others experienced false positives. False positives are a significant component of diagnostic process failures, contributing to adverse outcomes and patient harm, as shown in this diagram. The psychological impact of false positives can be substantial. Patients often experience anxiety and distress while waiting for confirmation. Many report fear and persistent worry about having a serious condition. The stress continues during follow-up testing, and research shows that some patients experience lasting psychological effects even after receiving negative confirmation. Clear communication and proper support are essential to mitigate these negative effects. Healthcare providers should explain test limitations before screening begins. Results must be communicated with sensitivity, providing clear next steps for any necessary follow-up. Emotional support resources should be offered and timely follow-up testing arranged to minimize the anxiety period. Well-designed screening programs have the power to detect diseases at their earliest, most treatable stages. Detecting diseases early provides several critical benefits: less toxic treatments, better outcomes, improved quality of life, and reduced healthcare costs. Let's look at real success stories. Breast cancer screening through mammography has been shown to reduce mortality by 25 to 30%. Similarly, colorectal cancer screening through various methods has been shown to reduce mortality by at least 25%. Effective implementation of screening programs requires coordination across health systems. Many organizations offer health risk assessments and biometric screenings for early disease detection. Screening programs contribute to broader health system goals, including improved health outcomes, equity, and financial protection. They're a critical component of comprehensive healthcare delivery. The timing of detection dramatically impacts outcomes. Early detection, as shown in this comparison of sepsis, typically leads to less severe symptoms and significantly lower mortality rates. The difference between early and late detection can literally be life-saving. Early detection pathways lead to better outcomes with less intensive interventions. Well-designed screening programs are essential for advancing universal health coverage. They improve population health, offer cost-effective approaches to disease management, promote health equity, and form a critical component of comprehensive healthcare systems. The evidence is clear. Investing in well-designed, evidence-based screening programs saves lives and improves public health outcomes for entire populations.